I'm Leo Christensen, and I'm the Executive Director of the Oregon Healthcare Quality Corporation. We are very excited. We have almost 100 people from all across the state with us. We have representatives from health plans, from hospitals, from health systems, consumers, people who work in the community, who we have all invited to join us to really look at an important problem in Oregon and across the country, which is how do we reduce the unnecessary hospital admissions that occur and that really keep people from their place, either their home or the place that they live and the place that they're most comfortable. And so we've asked all these experts to join us for the day to help us figure out how do we leverage the activities to make sure that we're providing the highest quality care for all Oregonians. A person may have some type of episode with their disease. They land up being admitted to the hospital. Their condition gets stabilized, but before they go home, maybe they didn't get the clearest instructions. Maybe they were too overwhelmed at the point of discharge. So they get home and they have many medications, they have many instructions. They find it difficult to sort of figure out what to do. And as a result of that, what frequently happens is they could take the wrong medications, they could not take enough of the right medications. Sometimes there are many providers taking care of patients, and it's hard to communicate with one another and to keep things straight. There are many activities that are occurring in Oregon, really exciting, pioneering efforts in hospital readmissions. Important steps like making sure that all patients have discharge instructions before they go home, but making sure that they have them in a way that they can understand them. So some organizations are producing videos or DVDs that patients can take home, or they have hotlines where people can call after they're discharged from the hospital to make sure that somebody is available to answer questions a couple days after discharge. One of the most important things we've learned is that even though all these activities are occurring, we still have a fair number of Oregonians who are readmitted in what we call an unnecessary admission. If they had gotten through to their primary care physician, or if their medications had been reconciled, or maybe if they had someone who could come into the home, if they'd had any number of these steps, they could have actually avoided going into the hospital because they would have never had their situation worsen. But today what we're really trying to do is remove some of the barriers between all of those great people all across the state and see if there's some synergies and if there's some solutions that maybe we can do on a much broader scale that have the opportunity to really improve this situation much more quickly and much more efficiently for Oregonians.